Well, if my life is not working in some way, if I'm having difficulty in making a relationship work, having difficulty getting along with people in my job, with my employees or my employer, and I have difficulty making it work, I have difficulty focusing on things, or I have difficulty believing that I'm going to be okay or I'm going to be liked. But if I feel like I'm worrying about how people are going to see me or how they'll think about me, all of these are problems that are pretty common for all of us in one form or another. And so if I have issues that I'm having trouble resolving and moving toward resolving them on my own, then the chances are I could use some help with a therapist, because I can learn other ways of interpreting things, other ways of dealing with things, changing my old childhood programming which set me up for it, and ways that I can communicate differently with myself and with others. And if I can learn that if I'm having trouble doing that on my own, then I could use the help of somebody to help me move along with that and to see what else I need to shift that will make that big difference in my life. Well, today, one of the more common signs is a lot of anxiety because of what's happening in the world with the coronavirus and the economy and the war situation and the violence that's occurring. It's stirring up a lot of fear and anxiety and mistrust and so on in a lot of people. And we don't see people as much. We don't see our friends as much or family members as much. And so we've been more isolated from that social contact. And these are all traumas for most of us. And we need to find some other ways that we can deal with them. Either find ways to make more of the connections, other ways of making a connection that's more effective and that's more understanding with the other person. How to present myself in a way that people will hear me. And rather than if I'm approaching them and just telling them what they did wrong, I'm going to be driving them away for the most part. And they'll just argue back. Then I'll still feel deprived. But I need to have ways that are going to work for me to get past my stress, my loneliness, the stress, or my judgments, or the isolation at work, or the reduction of income that I've had, or whatever it might be. Then I'll need somebody who can help me deal with those things and to make sure that my old programming is not interfering with me making the changes in a positive way. If I have difficulty in making relationships, be trusting and working and are satisfactory to me, that I can feel like people really hear me and they can understand what I'm saying, that I feel like I can really hear them and people can know I'm hearing them and understanding them and having feelings for them. Those are important for all of us in whatever relationships we're dealing with. We also may have more physical problems now because of all the stress. We know that 80 to 90% of all symptoms are stress is a major contributor, and that was reported in the New England Journal of Medicine back 30 years ago. But we need to know other ways of tools of dealing with the stress so we can deal with the issues at work and issues in relationships more effectively. And so we need to learn tools that would reduce that stress. And there are many that we can learn, some of the therapeutic process and some that we can learn from the therapist how to do them on our own, that we can reduce that stress and then stay much healthier and more functioning. Certainly if you'd like to learn more about these methods or these tools or the combinations of them and how they work, I'll be glad to talk with you about it. You could contact me by phone or by email, or you could call me and we can make an appointment or two and we could discuss it more in relation to your area, your issues, your problem areas, and what would be effective for you to do together. So I'd be happy to explore those things with you. I have people who want to come in person can see me in New York City or in Westport, Connecticut. Others may prefer to have session by Zoom or telephone or FaceTime or things like that. So that's possible too, especially during this coronavirus situation. So whatever works for you is I'm open to explore with you. But I'd be glad to answer any questions you might have about what this therapy is like.